You might be wondering what I'm doing here in a laser hospital. Well, I'm pretty sure you might not be able to see that, but just when I touch it and I feel it's kind of bumped up, just want to kind of get it removed. And before we reach anything, we paid 2 yuan for this kind of, I don't know, 门诊病历本. How to translate it out? No idea. 不拍你拍自己可以吧？医生呢？好的，是。Finished being lasered. In short, you can remove the mole by outpatient surgery, which is quick and not tended to relapse, and you can also get the mole be examined in case of any further potential damage. But the downside is you need to get a stitch and you also need to go back to remove the stitch, not to mention it might cost the highest. Or you can also get it lasered, but from internet it says that the mole is better to be less than 2 mm, and it also kind of tended to relapse, but we will talk that later because I tended to go with laser. Maybe you can even consider the liquid medicine, but I didn't do that because I don't know how it works and the cost isn't less than laser. But if anyone have tried that and feeling that it's not bad, you can also share your comments below. So after the research and based on my experience with the surgery, I would prefer to get lasered. The only question is that on internet it says the mole is better less than 2 mm, and obviously one of the mole is larger than that. So I was thinking, okay, maybe I have to get the surgery. But at that time my cousin told me that she actually had the experience and the laser is kind of okay. And after some hesitating and more research, I decided, okay, why not go to 2 different hospitals and consult the doctor and see which one of them will convince me more. So I started WeChat, found the application, and then consulted one of the well-known laser hospital in our city, and they also mentioned they have outpatient surgery too, so I decided, okay, let's go there. So I get there, checked with the doctor, and she kind of assured me that whether outpatient surgery or being lasered, it will definitely leave scar, which I'm actually okay with that, because I know the scar will be tiny, and I would prefer a scar rather than the bump mole. And one of the reasons that she stressed the scar is because for some patients, if the doctor telling them that there won't be scar, and then there is, the consequence is kind of severe for them, or maybe complicated. Anyway, she also pointed out for my case, if the mole is less than 5 mm, it can also be lasered. But if I prefer, I can do the outpatient surgery. Then I think, okay, because I needed to go to the gym and do some stretch stuff, and they had one more above my chest, so I thought, okay, maybe get a laser, since it will be easier for me. Since I already have some experience with the U-like, so I kind of understand how it works. So let's go get a laser. But the experience I had is kind of different from the internet. Mostly about the anesthetic, whatever. On internet, most mentioned it is the ointment, and you paste on skin after 20 or 30 minutes, you will get the anesthetic. From my doctor, they just use the injection, and the effect is almost immediately. Right after the injection, they get the surgery for me. I guess it's about the depth of the mole, but I'm not pro. It only takes less than 10 minutes, and there's one more thing I don't understand is that this mole is kind of 1 mm according to them, and here it's kind of 4 mm. But the 2 pits are actually exactly the same size, so whatever. It has already been 10 days, and the red pit is kind of smoothened, but it's actually more noticeable than before. Anyway, even before the laser, the doctor already listed these things which you needed to pay attention to, so I guess eventually it will be fine, right? Okay, you know me, conclusion time. So, outpatient surgery, laser, liquid medicine, which one should you go? Well, just to check on internet to get a basic understanding, and then try ask your friends, relatives around you to get their experience, and then don't waste your time anymore. Just go to the hospital, let the pro explain to you. It's just there are different types of mole, and we have different types of skin and physical body, so it's just difficult for the comments to tell you which one you should do, because what I have already experienced is almost 50% different as the internet. So what would you say, and which one suits you the best? See ya. One thing I regret to replace is the KN filter. Before you just need to replace a filter which cost $3. Now you have to dismantle this and then clean it and then dry it up. I forgot to mention, if you are curious about the price, where different area definitely will be different. In my case, it was 100 yuan for 1 mm, and totally she considered it's 5 mm. She did use a ruler to measure more on chest, but here she just eyeballed it. And then there was about 60 for a cream to like repair the wound. And then my medical care actually covers 170 like here. But if you consider the fun, because I rode motorcycle in the area which I'm not supposed to, so 100 more. And besides, there is possibility for the relapse, but the hospital guaranteed. Sure, I forgot it. I think it is that if it relapses in 3 months, because the skin needs to repair itself, and then you can go back and it will be free of charge. But the doctor also mentioned usually one time will be enough, because that's totally depend on doctor's skill and experience. So my recommendation, you really need to go and check it out by yourself. And no matter it is surgery or laser or other method, they are not enemigos. You just try this, and if it doesn't suit you, then do the next. Because let's just be honest, the more thing is almost nothing. You really shouldn't waste so much time and figure it out. Just get the job done.